All right, couple of things. One, there's no recording on chapter 15. Chapter 15 is basically immunology, which we did a better job of actually explaining in microbiology. Those slides work better than these ones do. And so I don't feel the need to go through all that again. If you need help any of that, just send me a message. I'll help you guys with that. Okay. So now we're moving on to chapter 16. Chapter 16 is really, really long, and so I'm gonna try to cut it down into 2 parts, if not 3. Okay. So bear with me. Chapter 16 is pretty long. Okay. Okay. Show. Okay, so the respiratory system is pretty straightforward, right? So let's get to where I want to actually go. Okay, so the physical properties of ventilation, okay? Air always goes from higher pressure to lower pressure, okay? Fundamental law of physics. The pressure difference between the two ends of the conducting zone occur due to changing lung volumes, okay? So compliance and SSE, surface tension, we'll go into each one of those, okay? Okay. Couple of definitions. Atmospheric pressure is the pressure outside the body, the pressure of the air outside the body, okay? If the pressure of air outside the body is higher than the pressure inside the body, air will rush into the body. If the pressure of air inside the body is higher than the atmospheric pressure, the air will leave the body. Okay, so that pressure inside the lungs is called intrapulmonary pressure. Okay, intrapleural pressure is the pressure within the interpleural space between the two pleuras. This will become important in a little bit, okay, when we talk about pneumothorax and stuff. Okay, so inspiration, okay, is generally about -3 millimeters of mercury. That's the difference between when the atmosphere from the outside and when you inhale. Okay, and then when you exhale, the pressure is about 3 millimeters of mercury greater. So you push air out. Okay. All right. So this transpulmonary pressure is this pressure minus that pressure. Okay. All right. Interpleural pressure, lower than the intrapulmonary pressure and atmospheric pressure in both inspiration and expiration. Okay. This keeps the lungs against the thoracic wall. Okay. Like this, you'll see what happens when this doesn't happen. And allows the lungs to expand during inspiration. Okay. All right. We can't actually control pressure, but we can control volume. And the volume of a gas is, or the pressure of a gas is inversely proportional to its volume. Okay. So if I decrease volume, I increase pressure. If I increase volume, I decrease pressure. Okay. And that is Boyle's law. Okay. Boyle's law, pressure 1, volume 1 is equal to pressure 2, volume 2. Okay. So an increase in lung volume during inspiration causes the intrapulmonary pressure to decrease and makes it below the atmospheric level, okay? A decrease in lung volume. So when we exhale, okay, we increase the pulmonary pressure to above the atmospheric pressure and air goes out. Okay, lung compliance. Okay, lungs can expand when stretched. Okay, so it's defined as the change in lung volume per change of transpulmonary pressure. Okay, so we can expand our lungs. Okay, under pressure. Okay, elasticity. The lungs return to normal size after being stretched. Okay. All right, hold on one second. Okay, sorry, I had to switch rooms because they were chopping down a tree right outside my door, which was really loud. So hopefully you don't hear this all anymore. Okay. Okay. The last concept I want to make sure you guys understand is this concept of surface tension. Okay. Water molecules like each other and they want to stick to each other. And so that generates a tension, like they don't want to split apart, so they want to stick together. And then that means there's a surface where a lot of water molecules want to stick together. And any type of bend in the surface will generate more surface area, and that will the water molecules don't like that. And therefore they want to resist that. And that resistance is surface tension. It's the same reason why like water and space form perfect little droplets, because that is the tightest pack that they can be. Okay, and your lungs are wet. Okay, which means they have water on it, which means your lungs, the surface tension of your lungs will resist expansion of the lungs. Okay. Okay. The fluid is absorbed by active transport of Na plus and secreted by active or Cl minus. Okay, people with cystic fibrosis have a duct problem that prevents, or channel problem that prevents the active transport of Cl minus, and therefore they can't secrete Cl minus, and therefore they can't move fluid. Okay. Yeah. So the pressure is directly proportional to the surface tension and inversely proportional to the radius of the alveolus. That's the law of Laplace. And so here, the smaller the alveoli, the more the tension. Okay. So the small alveoli would be at greater risk of collapse without surfactant. What surfactant does is it removes the surface tension of the water. Okay. Pneumothorax. Pneumothorax is when air enters the pleural space, which raises the interpleural pressure, so it collapses the lung. Okay. So the difference between there's always a little bit of expansion that keeps the lung expanded against your thoracic cavity. If you eliminate that pressure or you equalize that pressure, the lung collapses through the elastic recoil. Okay. All right. Okay. So you can see the collapse of the lung right here. Okay, so here's where the explain surfactant. Okay. I'm not sure if they explain this in your anatomy, but respiratory distress. So when you're fetus, you don't breathe at all because you don't. There's no air around you at all, so you don't breathe. Your oxygen comes through your umbilical cord, so you don't need to breathe. So you don't make surfactant until you're ready to be born. And so if you're born premature, um, you have your risk for RDS, respiratory distress syndrome. And that's treated with surfactant. That's also treated by putting babies on ventilators. That's also treated if they know you're coming early, like twins always come early. They treat you with steroids beforehand to get you to produce surfactant early. Okay. All right. Inspiration, expiration. You see the difference in volume between the two lungs. Okay. So split the muscles. Okay. Okay. Spirometry measures the amount of volume. Okay. So let's talk about a couple of definitions. Okay. So right now, you guys are all sitting in your chairs or beds or wherever you guys are watching this, and you're all breathing, but none of you guys are breathing very hard. So what you guys are breathing is called the tidal volume. The amount of air expired or inspired in quiet breathing, that's about half a liter of air a breath. Okay, the expiratory reserve volume is the amount of air that can be forced out after tidal volume. So you take a normal breath in and then you breathe out as much as you can. That is the expiratory reserve volume. Okay, the inspiratory reserve volume is you're breathing normally and then you all of a sudden suck in as much air as you can. Okay, the residual volume is the amount of air that's left in the lungs after maximum expiration. So there's always some air that's trapped in it. Like even if you push as hard as you can out, there's still some volume of air that's trapped in your lungs. That's your residual volume. Okay. Um, so let me try to explain it this way. Okay. Okay. This up and down thing is your tidal volume. Okay, so this is the amount of extra air you can breathe in. This is the amount of extra air you can breathe out. The expiratory reserve volume plus the inspiratory reserve volume plus your tidal volume is called your vital capacity. Okay, that is the amount of air I can reasonably breathe in and out at one time. Okay, like if I'm running really hard and stuff. Okay, I at maximum function, my lungs function at vital capacity. Okay, total lung capacity is this is vital capacity plus the residual volume. Okay. 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 The total minute volume, tidal volume times breath per minute, is roughly about 6 liters per minute. Okay, that's under normal resting, calm conditions. Okay. Okay. So there's a definition. Definition. Okay. Okay. Restrictive and obstructive disorders. Restrictive, the lung tissue is damaged, the vital capacity is reduced, okay, but forced expiration is normal. So what you are reducing really is the inspiratory volume. Okay. Obstruction is a blockage. So lung tissue is normal, the vital capacity is normal, but forced expiration is reduced. Okay. 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 So people with pulmonary orders, shortness of breath. Okay. Dyspnea. Okay. So obstructive lung disorder tests are usually diagnosed by doing expiratory volume tests. If you can't breathe out as much as you want to, then you have an obstructive lung disorder. Okay. Asthma is symptoms caused shortness of breath, wheezing, caused by inflammation, mucus constriction, mucus secretion, and constriction of the bronchioles. Okay. So I'm sure you guys understand asthma. Okay. Emphysema, you guys might not understand as well. Emphysema is the destruction of the alveoli, especially the alveolar walls. Okay, the walls of the alveoli is where gas exchange actually happens. Destruction of the alveolar walls reduces the surface area, so less gas exchange. Okay, fewer alveoli put pressure on the bronchioles, so they collapse. Okay, smoking is the most common cause of emphysema. It triggers inflammation and destruction of the alveoli. Okay, also causes a reduction in elastin. You can see differences here. This is normal. This is emphysema. Okay. COPD. Okay. Chronic obstructive pulmonary disease. Okay. Chronic inflammation, which leads to narrowing of the airways. Okay, and alveolar destruction of the alveolar wall. Okay, and that includes emphysema and chronic obstructive bronchitis. Okay. 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 So it includes emphysema and chronic obstructive bronchitis. Okay. Accelerate declining FEV1. That's the amount of air you can forcefully breathe out in 1 second. Okay. Okay. Excessive mucus production, inflammation triggered by smoking. Okay. Most people with COPD smoke. I think that's about 90% like ratio. Okay. Okay. Pulmonary fibrosis. Okay. Some people accumulate fibrous tissues in the lungs when the alveoli are damaged. This is when you actually breathe particles into your lungs, and that causes damage to your lungs. And then your lungs, instead of rebuilding new lung, it just scars over and fill. That's the fibrosis. Okay. Okay. I'm gonna stop right here. Okay, and go on to part 2 next.